This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWiV. This Week in Virology, episode 1210, recorded on April 17, 2025. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. Joining me today from New York, Daniel Griffin.
Hello, everyone.
Look at that bow tie.
It's we're back to anthrax.
Mm-hmm.
Remember all the anthrax stuff? That was a number of years back.
That was a long time ago, before I knew you.
Yeah,
I remember that. We still didn't figure out who did it. The guy at the FBI who they think did it died, and so that's it.
Committed suicide, right? There was like some question, and
yeah, I think so. But...
yeah, sad times. Well, let's jump right into it. We got a lot to cover, and I'm going to start with a quotation from William Osler. You know, and Osler, the more you read about Osler, must have been quite a character. He's kind of, some things that we stick with, some other stuff that are kind of questionable. But here's a quotation that I thought was appropriate. The future belongs to science. More and more, she will control the destinies of the nations. Already, she has them in her crucible and on her balances.
Should we send this to some people in the administration, Daniel?
Well, we'll get to that, but I think there's an important realization that science is power, actually. And it's an area where you want to be in the lead. You don't want to rely on other people to be doing the science and sharing the crumbs with you. So I do feel like an investment in science it's a national security issue. So, and I am going to start off with a few comments about the attack on science. Are you ready, Vincent?
I'm ready.
Okay. So I'm going to talk a little bit about, what's been going on at the NIH, the FDA, the CDC. I'm going to put on my glasses for this. What we're hearing, and a lot of people are aware of this, but I'm going to talk about what's sort of out there, but also we're going to share some firsthand accounts of it. But there's been a purge of thousands of federal workers that has halted efforts to collect data on everything from cancer rates in firefighters to mother-to-baby transmission of HIV and syphilis to outbreaks of drug-resistant gonorrhea to cases of carbon monoxide poisoning. Among offices shuttered by the layoffs is the CDC's Atlanta-based lab that analyzes samples of sexually transmitted infections from around the country, helping state and local public health workers know where an outbreak is happening, how many people are infected, where it started, how to stop it from spreading. And it really lots of cuts, but it looks disproportionately like they are targeting human health and services. So just to get a sense of the CDC, FDA, and NIH cuts that fall under HHS. So the confirmed cuts, we have 56,000 at least. There are more planned reductions up to 146. But of the 56,000 confirmed, 20,000 are human health and services. So really, it's they say reduction so far 24%. But if you look at that number, about more than a third of the cuts so far have been targeting health and human services. Gets a little bit worse. Internal budget document reveals extent of Trump's proposed health cuts. It's going to get worse. HHS would be asked to absorb a $40 billion cut, about a third of its budget. The proposal would reduce more than $47 billion budget of the NIH to $27 billion. So you're going to lose $20 billion just at the NIH, 40% pay cut. The proposal would cut the CDC's budget by 44%. From $9.2 billion to about $5.2 billion, would eliminate all the agency's chronic disease programs and domestic HIV work. The chronic disease programs being eliminated include work on heart disease, obesity, diabetes, and smoking cessation.
Hey, wait. I thought RFK wanted to focus on chronic diseases. What's this about?
So we're going to get into that. And here's, I'm going to get a little bit. So I've been getting some communication from folks on the ground, and I'm always very careful to protect their anonymity. Been hearing from folks at the FDA, the NIH, the CDC, and so I asked one of the people at the CDC that reached out. I said, "Can you send me an email, and I'll even edit this a little just to preserve your anonymity, so you're not going to get in any more trouble than you already are." But here I'm not sure you get in more trouble than the person is already in. They've already been fired. But I'm going to share this email in this section because it seemed appropriate here. This month, I was fired from CDC, and the proposed 2026 budget will not support continued publication of EID, the agency mouthpiece. That's emerging infectious disease. The MMWR, which is not peer-reviewed, will continue. RFK's new budget will also eliminate CDC's Center for Global Health. The combination of sudden cuts and thousands of federal public health workers and millions in federal grants to state health departments will ultimately disrupt public health for Americans and people globally. Institutional knowledge and intellectual capacity are being wiped out in front of our eyes, and CDC still doesn't have a director. RFK says he wants CDC to focus on infectious disease outbreak control, yet he has cut entire CDC labs. Take, for example, the STI, the Sexually Transmitted Infection Laboratory, which developed the Venereal Disease Research Laboratory test, the VDRL test, in the mid-1940s to detect syphilis, and has tracked trends for the nation of drug-resistant forms of gonorrhea, a pathogen which is down to the last drug for treatment, and helped states roll out the use of nucleic acid amplification tests to detect chlamydia. Like myself, the sexually transmitted infection lab staff were swiftly locked out of campus and lost access to their laptops. It is unclear how monitoring highly resistant strains at a national level can continue. 11 fellows training to be STI lab experts were left without mentors and had to be reassigned. Staff from other labs pitched in to ensure incubators were emptied, water baths unplugged, and biohazard waste properly disposed. Then there's the world-class CDC hepatitis lab, which worked on 5 different viruses, which was also shut down abruptly and cruelly. Since 2020, the lab supported 52 multi-state outbreak investigations involving an in-house state-of-the-art technology based on a combination of next-generation sequencing, AI, computational biology, and bioinformatics, which informed where best to target control efforts. The lab was shut down in the midst of an ongoing outbreak investigation centered on a Florida pain clinic, where they were in the process of confirming which of the hundreds of exposed patients were infected by the clinic. But samples submitted after the shutdown won't be processed. It just doesn't make sense to disrupt such a specialized technical service to states. RFK proposed to discontinue funding for Lyme disease, prion disease, chronic fatigue syndrome, and the harmful algal bloom programs to quote-unquote prioritize funding for core infectious disease and surveillance activities. The proposed budget involves a radical restructuring across DHHS with about 44% cut in funding, so it's surely going to be disruptive to the federal scientists and the state disease control program if no one speaks up. This is an evolving story, but expect dark times ahead as many pathogens reemerge. Thank you for all you do, keeping folks informed. Anonymous.
Malignant incompetence, Daniel.
It's just, I mean, the cruelty is what catches me in this communication. I mean, here we have people that have worked there for years, as we know, just done an excellent job through really tough times. And the idea that they're locked out of campus, they've lost access to their laptops, they're leaving these labs with water baths running and biohazard waste, not properly disposed of, shutting down investigations in the middle. This is just, it's the cruelty is really what shocks me here.
Also, this stupidity. There's no reason to do this. I mean, he wants to focus on this or that. You can do it all. We've known that. We've done that for years. We can focus on a lot of things. There's just no reason except that he thinks NIH, CDC, and FDA are all corrupt, and therefore they have to be disbanded. And there's no evidence to support that whatsoever.
Yeah. No, I mean, unfortunately, having sort of heard a bit of the communications to people working at these agency, that the view is that they're part of some big conspiracy to poison us with these approved products. Now, why is this happening? We touched on it a little bit, but I wanted to share an article. Like, where do these people get their followers? Now, there is a disturbing article, Political Ideology and Trust in Scientists in the USA, recently published in the journal Nature Human Behavior. I saw this thanks to a SIDRAP email, and I love that it's behind a paywall. I'm joking, tongue-in-cheek. But let me just start with the abstract. Trust in scientists is a key predictor of compliance with science-based solutions to societal challenges. Although liberals in the USA generally trust scientists more than conservatives do, it is not clear how these ideological differences vary across different scientific occupations and whether they can be mitigated. So here they have this report where it's a survey, 7,800 U.S. participants, and they demonstrate that even though the strength of the relationship between political ideology and trust varies across scientific occupations, liberals compared with conservatives show higher trust in most scientists. Moreover, following motivational accounts of scientist distrust, the study tested 5 theoretically grounded interventions, strategies to improve conservatives' trust in scientists, and none of the interventions were successful. Nothing. Suggesting that trust in scientists reflects relatively stable attitudes that require more elaborate and time-intensive interventions. And they have these wonderful figures, which hopefully David will have up for our viewers, but really interesting, Vincent, to see where you virologists sit on this scheme, right? So it's interesting. They don't even completely trust the mathematicians. All right. So, if you're going to be a scientist, the mathematician, the zoologist, the marine biologists are up there. I started my college as a marine biology major. And then, it's one of those jokes I have with my dad. He's like, Daniel, if you find something you'll love, you'll never work another day in your life. I'm like, yeah, either because you love it or you picked marine biology and there's no jobs, Dad. But at the very bottom, we have climatologists, environmentalist scientist, and virology as the least trustworthy.
Yep. We are not trusted.
But at least they know who you are. They know what that is.
Yeah. Right. Well, Daniel, all this damage is being done. You remember that big document that came out before the election on how the conservative Christian left, right was going to redo the government? Yeah, well, that's what this
was
the
now. 2025. Was that
the 2025
Project 2025,
plan, which is authored by a small number of people who don't trust science. They don't trust these big institutions, and that's why we're doing this. I think the majority of people in the U.S., when polled, understand the value of science and public health. But we are now caught by a conservative religious minority who has no business running this country.
It's kind of amazing how it's shifted in my lifetime, right? I when I was in college, it was the liberals who didn't trust science and medicine and all this, and it was the conservatives that were like, no, this is what we've established, and it was sort of intrinsic to conservative as wanting to conserve like what we had built. And now somehow we have this shift, which we're seeing here. So, and unfortunately, this, as we're seeing, at least from the data here in front of us, is that this is not going to be an easy fix.
Most people don't realize is that this triumvirate, the government, universities, and companies, for the last 80 years have been a driver of economic growth in this country. It's stunning how much growth they have made because they collaborate together.
Yeah.
And now that's being broken, maybe with the idea of privatizing some research, but it's not going to be the same. It is not the same as this collaboration.
Yeah, I know it's been tremendously successful. I think, the proof of the pudding, and we're preaching to the choir here, but just Operation Warp Speed, the idea you can go from a brand new pathogen entering our population to a highly effective and safe vaccine in a year. I mean, that's just amazing that that was a partnership. That was the government supporting private industry. That was a lot of collaboration with academic institutions that had developed a lot of expertise and a lot of the basic science. I mean, here we have, like, we should be celebrating this. So, all right, moving on. Did you hear about this, Vincent? Apparently, there was a deadly E. coli outbreak that hit 15 states, but the FDA chose not to publicize it. So let's look into what's happening here. And I joke because Vincent sent me this, but I had actually seen this and sort of had the same response. Like, what is happening? So here, there's an E. coli outbreak. It's linked to romaine lettuce. It, quote unquote, ripped across 15 states in November, sickening dozens of people, including a 9-year-old boy in Indiana who nearly died of kidney failure. A 57-year-old Missouri woman fell ill after attending a funeral lunch. One person ends up dying. And in February, the FDA indicated that they closed the investigation. They're not going to publicly detail what happened, and they're not even going to talk about which companies were responsible for growing and processing the contaminated lettuce.
So this struck me because, RFK Jr. says he wants transparency, and this is not transparency. The CDC, FDA, they always used to publicize outbreaks so people could be aware of them and steer clear of them. And this makes no sense whatsoever, except in a dictatorship where you want to control the flow and keep the people uninformed.
Okay. Getting fired up there, Vincent. All right. So from the WHO, okay, they're still out there. I was able to access this site and get blocked by some paywall, which seems to happen, or somehow I get you can't access this site from the U.S. I'm going to test some of these sites when I'm in France next week. But from the WHO, disease outbreak news: invasive meningococcal disease, Kingdom of Saudi Arabia. So March 13th, 2025, the International Health Regulations National Focal Point for the Kingdom of Saudi Arabia reported 11 cases of invasive meningococcal disease to the WHO. Additionally, between 11 February and 18 March 2025, the WHO Eastern Mediterranean Regional IHR contact point received reports of 6 isolated cases. So these cases involved individuals who had recently returned from Umrah. The government of Saudi Arabia regularly issues health requirements for Hajj and Umrah, including vaccination policies. But as we find out, only about half of the folks, half of the international Umrah pilgrims actually comply with the meningococcal vaccination requirements. So what is Umrah? What is Hajj? I put in a little bullet point on what they are. So people have probably heard about the Hajj, right? So that's the obligatory, mandatory for all able-bodied Muslims who could afford it, one time in your lifetime. You go during a specific time of the year, the last month of the Islamic lunar year. Takes place over about 5 days and includes standing at Arafat, stoning the devil, and sacrificing an animal. Curious what animal choices are there. Umrah. This is not mandatory. This is voluntary. It's a recommended act of worship. You can do it any time of the year. You can complete it in a few hours. And it involves Ihram, the sacred state, Tawaf, circumambulation of Kaaba, Sa'i, walking between Safa and Marwa, and Tahallul, termination of Ihram. So I say it's sort of appropriate because we just at the last meeting, there was a recommendation for a new meningitis 5-valent vaccine. So. And measles. Ouch. I'm going to leave a link to the ID Society website. They have a measles vaccination Know the Facts webpage. It's really well done. So I'll leave a link in there. But what is going on? Well, CDC scientists, those cuts we talked about, Texas measles outbreak response hurt by funding cuts. A senior scientist overseeing the measles response for the CDC said a recent pullback of pandemic funding from states has hurt Texas's response to its growing outbreak, now linked to 90% of cases in the United States. And what are we getting? We are over 700 as of noon last week. Over 700 confirmed cases in 25 jurisdictions. So it's about half of the country. We're seeing 32% are under 5, 38% are 5 to 19, 28% are over 20, a couple percent we're not sure about age, 11% have ended up in the hospital. And of those ended up in the hospital, 20% are under 5, 7% are those adolescents, 5 to 19, 6% of the folks over 20 have ended up hospitalized. So Texas has 561 cases since January. This is another 20 up since the April 11th update. Most of it over in the West, but we're seeing a few other spots where we're getting some outbreaks. New Mexico is up to 63. And again, kind of that distribution with 17, 0 to 4, 19, 5 to 17, 27 are 18 or over. And our friends in Mexico and Canada has reported more than 730 cases so far this year, making this one of the worst measles outbreak in their country since 1998. Mexico has seen at least 360 cases and 1 death, most in the northern state of Chihuahua, which is actually right up there close to Texas. An updated table from NYP for measles vaccination, and they're adding a little section here on recommended prior to high-risk travel. So we can potentially share that with folks, goes through the measles contraindication, and continuing with our measles MMR vaccine safety information. All right, flu. It's looking good. Looking good, Vincent. Look at flu. Look at how green our country is getting.
Mm-hmm. I see.
Everyone's, switching over to solar. I think that's what that means.
No, I thought we were switching to coal. That's what.
But yeah, flu activity is really headed in the right direction. Most of our country, it's low or minimal. There's only a few places with moderate activity still going on. So really coming out of what was really a pretty bad flu season. A lot of hospitalizations, lots of deaths. There was a headline in SIDRAP, U.S. flu levels drop below baseline, but kids' deaths approach 200. So some more kids this last week did not survive the flu season. RSV also going in the right direction. And we get an update there. So that ACIP met. Do you know they met this week? We got some recommendation. And they voted to expand the recommendation for Pfizer's RSV vaccine, Abrysvo, to include adults aged 50 to 59 at increased risk of disease. The vote expands existing recommendation, which was for all adults aged 75 and older, and the high risk was 60 to 74. Now it's high risk 50 all the way on up. And what are those high risk conditions? Obesity, which no one thinks they have, cardiovascular disease, diabetes, COPD, asthma, other chronic or immunocompromising conditions.
So it's good. We've had a lot of letters from people who say they go to the pharmacy and they say, no RSV, you're not 75. Now this gets around that.
Yeah. If you're 50 and you've got any kind of chronic condition, talk to your doctor. As we talked about, what was the issue here? There was a safety signal. Pretty much all in South Africa was the safety signal for the Guillain-Barré. And as we're seeing, post-marketing surveillance, just getting more and more comfortable with this vaccine. And remember, RSV is responsible for tens of thousands of deaths in the U.S. alone every winter, hundreds of children dying every winter, a lot of hospitalizations. And I will share a new article on RSV. The article, Respiratory Syncytial Virus and Incidence of Cardiovascular Events, a nationwide self-controlled case series analysis published as a brief report in JACC. So another study from our friends, our Danish friends, Danish healthcare registries, which provide industry-level data on demographic characteristics, medical diagnoses, prescription claims, and microbiology test results with complete data linkage for all citizens. They identified all citizens aged 65 or over who tested positive for RSV from September 16, 2022 through May 2023. And they found that the incidence of both heart failure hospitalization and ischemic stroke were 4 to 8 times higher during the 14 days after testing positive for RSV compared with the control period, and the incidence was elevated by a factor of 6 compared with the control period. So really crazy, right? We talk about deaths, we talk about hospitalizations, but heart failure and stroke linked to RSV. And they're sending us wonderful science like this without any tariffs, and we're tariffing the Danes. But we're not really tariffing the Danes, as I learned today, Vincent. I don't know if you know about this, but I have a sailboat. And in the winter, we take the mast off and we store it. Mm-hmm. And it was in this shed with a whole bunch of other masts. And the shed caught on fire, right? And all these masts got destroyed. So I've got to get a new mast, and my boat's from Denmark, so we got to order a new mast from Denmark. They're gonna charge me. That's the way tariff works. So here's my bill, right, for my new mast, and then they tag on like thousands of extra dollars that I have to pay to the U.S. government. And the Danish are not paying that. I'm paying that tariff.
Of course, the increased cost of their goods is bad for them because fewer people will buy them. But the tariff is borne by Americans. It's another friggin' tax. Make no doubt about it.
That's really what it is. I mean, I'm stuck, right? This boat was built there. That's the mast that works. I mean, I either have a
many medicines come from other countries, the medicine components. So that's going to be a problem as well.
Some of those GLP-1 drugs that people are using to try to get their weight down, right? To try to be at a healthy weight. Yeah. All right. So COVID update, according to CDC, the national wastewater activity is low. The percentage of deaths are across the country down. And I love our multicolored curve. We're down into the pretty much low. If you look, we just got in there low across the country. We had a little bit of a blip this week because the Jewish holidays, right? So we had a bunch of folks get together, and I think people have sort of moved forward. And unfortunately, I'm getting some check-ins from some older folks who are now testing positive. And for, people who are either older or have high-risk conditions, this could be a problem, ending up with hospitalization, long COVID, not surviving. And that's really the case. I mean, I have a woman in the hospital. I'm not sure she was going to make it. She came in during the second week with hypoxemia, still within 10 days. So we were doing the remdesivir, the steroids. She looked like she was turning the corner. And then when I went in today, she's on high flow, non-rebreather. She's picked up a secondary bacterial pneumonia. The white count's up in the 20s. And I was talking to the daughter about this may be a terminal event. So. All right, moving forward to children, pregnant individuals, other vulnerable populations. We have the article, Comorbidities Associated with Different Degrees of Severity in Children and Young People Hospitalized with Acute COVID-19. And this was PIDJ, so Pediatric Infectious Disease Journal. So I just want to point out, right, this is hospitalized children. So this is a prospective cohort study with 2,326 hospitalized children and young people with coronavirus 2019 in Spain and Colombia. Now, thousands of kids hospitalized. So, people are going to say, COVID was never a big thing in children. But I'm pointing out, we are looking at a study here with thousands of children that got sick enough that they ended up in the hospital. 36.4% had comorbidities. 64% did not. It's really interesting because they say, the incremental risk with additional comorbidities underscores the importance of targeted vaccination strategies. I'm pointing out 64% of these kids were absolutely fine. So just sort of talk about that there. So asthma, recurrent wheezing, chronic neurological, cardiac, pulmonary diseases significantly increase the risk of severe outcomes, mechanical ventilation, ICU admission. But remember, 64% of these kids were completely healthy. They end up in the hospital with COVID that severe.
Marty Makary, head of FDA, Jay Bhattacharya, head of NIH, both said, don't have to immunize the kids. Let them get infected. It's okay.
I mean, thousands of kids ended up in the hospital. Over 1,000 children died. I mean, people are trying to rewrite the narrative here. And we need to stand up. I mean, the truth is the truth. All right. Another update on active vaccination. SHIELD Utah study shows Novavax's COVID-19 vaccine induces less reactogenicity symptoms compared to mRNA. So this is something we've been talking about for a while. And here we have 219 healthcare workers that received Novavax. 369 received, they call it the Pfizer product. That's funny. This is from the Novavax's website. That's, I think, why it's worded this way. But 2 and 7 days after immunization, these folks completed a questionnaire, asked about the reactogenicity symptoms, their effects on daily activity. 20% were physicians, about 20% were nurses, 11.9% were medical assistants. And they presented these preliminary results at the Congress of the European Society of Clinical Microbiology and Infectious Diseases in Vienna. Basically, on average, workers who received Novavax had 1.7 systemic symptoms compared with 2.8 in the Pfizer recipients. In total, 43.8% of the Pfizer vaccinees reported at least one symptom of moderate or higher grade, compared to 24.2% of the Novavax folks. Workers who received Novavax reported 12.5% fewer local reactions than the Pfizer folks. Average hours of side effects leading to reduced activity with low in Novavax was 0.7 versus 1.4 hours of missed work, and 0.8 versus 2.4 hours of lower productivity. So just more data on the lower reactogenicity with the Novavax. And remembering we still, and this may be changing, we've heard, still making CDC routine vaccination for everyone across the board. It's sort of a traditional U.S., broad vaccination recommendations. And then for those folks, sort of a little bit of a targeted, we'll call it a European style, for folks 65 and older or folks with higher risk conditions, considering getting a shot every 6 months instead of just once a year. But as I sort of alluded to, the U.S. CDC outside panel of experts on Tuesday, April 19th, did discuss that there might be narrowing recommendations on the use of these COVID-19 booster shots, in upcoming years. We'll get a formal recommendation in June, so that hasn't been changed yet. Okay, and then we have the early viral phase, still Paxlovid, remdesivir, molnupiravir, convalescent plasma. And in that second week, steroids, anticoagulation, pulmonary support, some role still of remdesivir, immune modulation. All right, and we're going to wrap things up with the late phase, past long COVID. And again, we're talking about kids and COVID. The article, Kidney Function Following COVID-19 in Children and Adolescents, was published in JAMA Network Open Nephrology. These results are from a retrospective cohort study that used data from 19 health institutions in the NIH Researching COVID to Enhance Recovery, the RECOVER initiative, from March 1st, 2020 to May 1st, 2023, among 1,900,146 pediatric patients, 487,378 with, 1,412,768 without COVID-19. About half of them were male, median age 8.2. SARS-CoV-2 infection was associated with a higher risk of new onset chronic kidney disease, stage 2 or higher. And that's an increase of about 17%. Chronic kidney disease, stage 3 or higher, that was a 35% increase. In those with pre-existing chronic kidney disease, COVID-19 was associated with an increased risk of kidney events, about 15% increase. Children with acute phase, acute kidney injury had elevated hazard ratios, about 29% for these outcomes. So in this study, they observed an increased risk of a composite outcome of having at least a 50% kidney function, GFR decline, GFR 15 or less, dialysis, kidney transplant, or end-stage kidney disease diagnosis. And this aligns with prior studies. So remember, this is kids. And I really think it's important for us to have this conversation because there's this growing idea, right, that it was really just a problem for those over 65. The rest of us should have been out there. We should have let it rip. History is being rewritten. And as we've already mentioned, over 1,000 children died of COVID. Tens of thousands of children were hospitalized for COVID. We had hundreds of cases of multi-system inflammatory syndrome in children. And here's another article, Cardiovascular Post-Acute Sequelae of SARS-CoV-2 in Children and Adolescents, cohort study using electronic health records, published in Nature Communications. This paper assessed the risk of a number of cardiac signs, symptoms and conditions 28 to 179 days after SARS-CoV-2 infection, using EHR data from 19 children's hospitals and health institutions from the U.S. Again, the Recover Consortium. And this cohort included 297,920 SARS-CoV-2 positive individuals, 915,402 SARS-CoV-2 negative controls. Each individual had at least 6-month follow-up. They found that children and adolescents with prior SARS-CoV-2 infection had significantly increased risk of various cardiovascular outcomes, including hypertension, ventricular arrhythmias, myocarditis, heart failure, cardiomyopathy, cardiac arrest, thromboembolism, chest pain, palpitations, compared to the uninfected controls. So they have this nice forest plot figure where they look at children, and they break them down into children with or without congenital heart disease. So let's focus first on the non-congenital heart disease patients. So these are kids, right? Kids and adolescents. We're seeing an increased risk of hypertension, 47%, ventricular arrhythmias up by 49%, premature atrial or ventricular contractions up 77%, pericarditis. Remember we talked about this rare temporary inflammation that we see with the vaccines? Well, here with COVID, we're seeing an 85% increase, so a pericarditis relative risk of 1.85. The myocarditis relative risk, 3.66, so almost quadruples the risk. Heart failure up, relative risk 1.76. Cardiomyopathy, 50% increase. Cardiac arrest in little kids and adolescents up 56%. Cardiogenic shock, relative risk 3.15. Pulmonary embolism 1.6. Thromboembolism 1.3, and it goes on. So just really reinforcing that this mistaken assumption in the Great Barrington Declaration about let it rip, and this whole idea as we rewrite history that, it was just fine for kids to get COVID and they didn't have any problems.
Million signatures on that declaration, 1 million people who know nothing about infectious diseases, apparently.
Isn't that amazing that there's almost 1 million signatures on that Great Barrington Declaration?
Well, you can get anything to sign your document. They don't even know what they're talking about. The authors don't know what they're talking about. How can you take a brand new virus you know nothing about and say, let it rip? This is so ignorant. It's unbelievable.
And then we'll find out after the fact that, oh my gosh, or after the fact, we'll forget and ignore the fact that, all these kids.
Malignant incompetence.
Yeah, over 1 million people are dead. Kind of crazy. All right. We also have from the IDSA, we get therapeutic updates on long COVID where things stand 5 years later. And I'll leave in a link to this. It's an update from Luis Del Carpio Orantes on failed trials, some promising trials, and a number of trials looking at non-pharmacological interventions such as transcranial direct current stimulation, acupuncture, vagus nerve stimulation, stellate ganglion block, and others. And I'm going to leave in a link. I think that after our discussion, maybe some of our listeners might be fired up. Do you think that's possible, Vincent? They'll want to reach out to their representatives. And this is not a partisan thing. A Democrat, Republican, Independent. Reach out. Let your representatives know if science is important to you and you want us to continue to be the world leader in science. Reach out and share your views. And as we've been saying for, over 5 years now, no one is safe until everyone is safe. We can only do what we do with your support. Hoping everyone will pause. And I do mean everyone, not just a few people. We need your support to keep doing this. Parasiteswithoutborders.com, click on the donate button. You can go to microbe.tv, click on the donate button there. If you go to Floating Doctors, they've got a fundraiser that we're helping support. We're trying to get up to a maximum donation of $20,000 to help them with the great work they're doing down there in Panama.
Time for your questions. For Daniel, you can send yours to daniel@microbe.tv. Lisa writes, thank you for all your clinical updates. Your description of pertussis infection reminded me of the breakthrough Bordetella infection our dogs got in August. That and that the disease share a genus got me wondering, why do pertussis vaccinations protect humans for so much longer than kennel cough vaccinations protect dogs? Is it that there's a lot more kennel cough circulating, so the bacterium gets many more opportunities per year to mutate than the whooping cough bacterium does. After what happened last year, our dogs are getting their Bordetella vaccine every 6 months instead of annually, at least for the rest of our 16-year-old dog's life. Both dogs recovered, but our elderly one still coughs a lot more than he did pre-infection.
Yeah, it's interesting, right? So it is a different Bordetella that we see causing kennel cough. And also a different vaccination. So the vaccinations we're using in humans are the acellular pertussis. Aren't you impressed that I know all about dog vaccines?
I knew you would, Daniel.
Obviously.
I just knew it.
Obviously a dog person. So it's a Bordetella, like Bordisepticemia type. So it's a little bit different. And there's a couple different routes to the vaccination, but the vaccination, it's a mucosal vaccine. So there's either a spray or there's the in the mouth, like applied to the buccal of the dog. And they recommend like a once a year. That's a general recommendation. It's not based on the best data. But no, it does not seem to be giving that same, lifetime, or not really lifetime, right? Because we're talking in adults doing it every 10 years as well. So there does seem to be a little bit different, we think. But again, there's not as much data.
Gene writes, I'm a reverent listener, follower, and occasional donator. Today I'm seeking some personal advice. My daughter, lawyer, RN, mother of a 3-year-old daughter, is wanting to start raising backyard chickens. I frequently send on your podcasts or clips to her on various infectious disease topics that you have discussed on TWiV. So she's very aware of what's happening in the world of infectious disease. With the spread of H5N1, I'm concerned that they will become infected and possibly that I, 74, will also when I visit them in Charleston, South Carolina. Please advise this grandmother. Is this a real concern? I don't believe this to be a smart time to keep backyard chickens. I love the banter between the two of you about our political situation now, so please keep interjecting it into the discussions.
Okay. Yeah, we definitely get some comments about our political comments because, well, as we say, you mix politics and science, you get politics. You mix politics and medicine, you get dead children. We will keep. Well, I don't know how we cannot because no, it should be a partnership. This is an interesting thing that came up. And we did talk about the fact initially the thought was that there hadn't been any transmission. Then there may have been one transmission from backyard chickens to a person. I don't think it's a high risk activity. But yeah, it is a little bit interesting. Here we are in this time, right, where there's shortages of eggs. The prices just keep rising. They're up another 20% from February to March. Haven't seen what they're going to be around Easter, but usually there's increased demand and less supply. So yeah, go buy your eggs soon. This will come out on Saturdays. You're going to have to rush to the store to get those Easter Sunday eggs. This is not a horribly high risk activity. But yeah, I think, as you're noticing, you got to keep track of what's going on, and that's going to get a little harder in coming months, as we discussed.
Eric writes, with the recent news that Gene Hackman's wife died of complications relating to hantavirus pulmonary syndrome in their home north of Santa Fe, New Mexico, it made me think I should probably use an N95 respirator whenever I'm sweeping my basement crawl spaces or other parts of my home where mice are known to frequent. Well, I live in the suburbs of the Bay Area. There are a lot of rodents that live in and around the open spaces. CDC shows that from 93 to 2022, there were 864 cases of Hanta, mostly in the West, Pacific Northwest, and Southwest. While the risk is relatively low, a mask is easy enough to don for these limited activities. Would you agree that an N95 is an appropriate precaution for people in this situation while cleaning?
Yeah, so Eric, I still remember when we had that big Four Corners investigation, and I think there's like a great book that I remember reading about what happened. I actually went out to New Mexico and met with some of the physicians that took care of the folks when they first started coming in, and then practicing out west, I took care of a few people, and this story was always like the wife and the daughter that went to clean the cabin in the spring, and they swept it out, and then they would come in with the pulmonary symptoms, and we were involved in some some of the antiviral trials. If you think about it, if you're going to hire someone to sweep these places out, OSHA would probably want them wearing an N95. So I would agree. If you're going to go and sweep a place that may have these mouse droppings, then why not go ahead before you aerosolize and breathe in the hantavirus? Why not don an N95, open the windows and doors, really get that sweeped out?
Caroline writes, great news about shingles vaccine preventing dementia. Was there anything in the study to indicate whether the vaccine prevented dementia in folks who had previously had shingles, or does it only help folks who have never had shingles before?
Yeah, so we don't know. That was a great study as far as really just narrowing, like you're born, this week, September 2nd, the week before or after. But yeah, there were a lot of things in there. You can kind of go through the data, which we didn't necessarily have, is had the person had shingles before or not. I'll speculate. Vincent, you speculate too. There's this whole idea that it's actually the virus triggering some kind of an immune response and deposition of tau. And so, if someone's having reactivations before, maybe they're the person who's even the most important to get this vaccine. But we don't know. We're speculating. So any thoughts there, Vincent?
So many of the participants in this trial had shingles before, and when they got the vaccine arm, the incidence decreased, as you would expect. The shingles, the disease, is thought to contribute to dementia. Right. So if you can prevent it with a vaccine, you're going to decrease the dementia. So they didn't really stratify the data, as you are saying, but they certainly have it. And Pamela writes, today I want to give you and Vincent some backstory on Gerald Ford, since y'all were making fun of him for falling downstairs, even though he was supposedly athletic. An ophthalmologist told me the problem was he had contact lenses prescribed for monovision, that is one distance lens and one for reading, which is an alternative to bifocals. However, that strategy limits depth perception, thus he had trouble judging where he was walking. Anyway, I thought we shouldn't unfairly malign President Ford.
No, this is great, Pamela. I'm a fan of Ford, so I hope it wasn't taken as a maligning. I was kind of pointing out that even though people made fun of him falling down the stairs, he actually was quite an athletic man. And, knowing people who interacted with him personally, I also appreciate that he really did tremendous things for our country during a difficult time and was reportedly really a fine gentleman. So, yes. So President Ford, hopefully you were not offended, even though he's not actually around anymore.
Maybe he was our last honest Republican president. Who knows? That's TWiV Weekly Clinical Update with Dr. Daniel Griffin. Thank you, Daniel.
Oh, thank you. And everyone, be safe.